Okay, so I'm doing my oral presentation on asthma. So my case study is on Mary. Mary is a 15-year-old female who has presented to ED with complaints of sudden onset of tightness in her chest, shortness of breath, wheezing when breathing, and a productive cough. Mary, prior to arriving at ED, had decided to go for a run around her neighbourhood to improve her general fitness before trying out for a school's netball team in the coming months. Mary states she only started noticing these symptoms 5 to 10 minutes after finishing her run. Mary's initial vital signs upon admission were a heart rate of 105, a SpO2 of 95%, a respiratory rate of 19, a blood pressure of 140/88, and a temperature of 37. Mary's mother noted Mary seemed fatigued on the way to ED. Mary has a past medical history of eczema which runs in her family, with both her mother and grandmother having eczema. 30 minutes after admission, Mary tells nurses she is starting to feel better and is having less difficulty breathing. Upon doing a focused respiratory assessment, the nurse caring for Mary auscultated her chest and back, noting wheezing on expiration. The nurse also noted slight use of accessory muscles when breathing, but no abnormalities in the chest upon visual assessment. Diagnosis, signs and symptoms. Mary's symptoms she's experiencing indicate she is experiencing mild to moderate asthma symptoms, more specifically exercise-induced asthma, as she has no past medical history of asthma. Symptoms of asthma include shortness of breath, wheezing, coughing, and chest tightness, which directly line up with her complaints. Furthermore, Mary's sudden onset of these symptoms 5 to 10 minutes after finishing her run match up with maximum bronchoconstriction occurring between 10 and 15 minutes after exercise, in the case of exercise-induced asthma. Additionally, Mary's claims of starting to regain her breath 30 minutes after admission, showing an improvement in her symptoms, ultimately indicates her having asthma, as airway function is largely recovered within 16 minutes in cases of asthma that has been induced post-exercise. Another sign of Mary having asthma is her past history of eczema. Having both atopic dermatitis and exercise-induced asthma is common in children who have one of the two conditions, so it would further indicate, based on Mary's medical history and family history, that her sudden respiratory issues after exercise are due to asthma. Pathophysiology. The pathophysiology of asthma involves a trigger which can be intrinsic or extrinsic, which causes inflammation of the airway and increased mucus production, resulting in difficulty breathing. When a pollutant or substance is inhaled, mast cells release cytokines and eventually degranulate. Due to this, the mast cells release histamine, prostaglandins, and leukotrienes. I have no idea how to say any of them. Which causes the contraction of smooth muscle, thus tightening the airways. Airways, causing the wheezing sound upon expiration, which relates to Mary's symptoms. Furthermore, this narrowing and inflammation causes increased mucus production, resulting in a productive cough as a means of clearing the airway, which is seen in Mary. Additionally, asthma reduces intake of oxygen and output of carbon dioxide, which reduces oxygen in the blood, which in turn leads to a fatigue in the body, as the body is receiving less oxygen than usual, which, as noted by Mary's mother, Mary is experiencing fatigue. This lack of gas exchange will cause changes in vital signs as well, causing patients with asthma to have an increased heart rate, respiratory rate, increased use of accessory muscles, which is seen in Mary upon admission. With exercise-induced asthma, the pollutant triggering the flare-up is the cold and dry air travelling into the lungs. As this air is not moist from being taken in through the mouth and nose at a normal rate, instead it is rapidly taken in through the mouth, causing irritation and a flare-up in symptoms. Potential complications. Asthma, if left untreated, will progressively develop and asthma attacks will become more frequent. With the increase in attacks, damage to the airways in the lungs will become more likely and will result in scarring of the lungs, which in turn can cause permanent breathing issues. Potential issues for Mary and goals. Potential issues for Mary would be a potential relapse of symptoms she's experienced after her run the next time she does any strenuous exercise, which may result in her being admitted to hospital again. To address this issue, the goal of preventing further asthma attacks induced by exercise must be established. Also, a second issue is future damage to Mary's lungs. Establishing a goal of enabling Mary to treat her asthma herself will allow this issue to be prevented. Relevant nursing interventions. Intervention via providing education is a vital part in achieving both established goals for Mary. Giving her education on her condition will allow her to remain active and participate in sports safely, while empowering her to know she can handle herself if a flare-up occurs. Providing education on corticosteroids and inhalers for both her and her parents will give them a greater understanding of how to handle a flare-up and what to do and what is needed to be done to prevent any damage to Mary's health. And an example of education you'll provide is things like diagrams, as seen on the side of the screen here. Even though it's an older reference, it's still relevant to how a inhaler works and would benefit Mary and her family in understanding how one works and how it would treat her. Education is an effective intervention to achieve both goals, as it enables both prevention of relapse, as Mary will understand her condition and how to handle it, but also in turn prevent any complications to her health as of a result of uncontrolled asthma attacks. Furthermore, intervention through teaching breathing exercises will additionally help address both goals and allow for them to be achieved. Prompting breathing through the nose and overall slow breathing will enable Mary to prevent flare-ups of any asthma symptoms. By doing this, it will prevent the increased intake of air through the mouth and reduce the chance of any irritation in the airways, as explained in the pathophysiology of this condition. Both of these interventions allow for both established goals and issues to be successfully tackled, and both are easily measurable as to how successful they are through Mary's ongoing management of her asthma and minimal relapse of symptoms. There is my bibliography, and that is it. Thank you for listening.